And good morning. I'm Dr. Susan Love, the president of the Dr. Susan Love Research Foundation, and we want to welcome you to the Army of Women Research 101 monthly webinar. We hope today to give you an overview of our Army of Women, what it is, what you can expect, as well as some examples of research that we've done with the Army of Women. Today you're going to hear from two people. Leah Wilcox Eshraghi, our Army of Women Research Project Manager, will start off and review the Army of Women and what we are and what we can do. And then Jennifer Ivanovich, a genetic counselor and research assistant professor of surgery at Washington University School of Medicine, will talk to us about her study, the breast cancer risk study in young women, for which the Army of Women is recruiting, and give you an example of what the Army of Women can do and how it is different from standard recruitment methods. So with no further ado, I'm going to hand this over to Leah Wilcox Eshraghi. There, I got it all out. Thank you.
All right, everyone. Thank you for joining us today. And just to let everyone listening know, you are on listen-only mode, so if you have questions, please feel free to type them in, and then we'll go through those at the end of the session. So I'm just going to get started with a quick overview of the mission of the Dr. Susan Love Research Foundation. We're working to eradicate breast cancer and improve the quality of women's health through innovative research, education, and advocacy. And our real big goal is to identify the barriers to research, to explore new approaches, and create new solutions. And one of those new solutions is the Army of Women program. So the Love Avon Army of Women is a program of the foundation. This groundbreaking online initiative launched in 2008 with the goal of recruiting 1 million women to participate in breast cancer research. We launched thanks to funding from the Avon Foundation for Women, and they continue to support us. We connect a variety of breast cancer researchers with women who are willing to participate in a multitude of, but we're really looking for those looking into the causes of breast cancer and how to prevent it. And we encourage all men and women over the age of 18 to sign up, whether they are affected by breast cancer or not. And I think that's a really important point to make, and you'll see on a later slide that the majority of our Army of Women members are actually people without a personal history of breast cancer. So you have a lot of healthy control women there to study. The goals of the Army of Women: we want to encourage all women to take the next step in breast cancer advocacy and actually participate in the research studies. And in doing so, we want to get them invested in the concept of research to find the answer. And really, with our researchers that recruit through the Army of Women, we're forging a partnership between these women and the researchers to end breast cancer. Some of the other goals: we want to increase the amount of research focused on the cause and prevention of breast cancer, and accelerate research by providing research access to this pool of healthy volunteers. So how does it work? If you are a woman or a man and you want to sign up, you would go online to our website to receive our email announcements of available studies. We keep the sign-up process very simple. We ask for basic contact and demographic information, such as year of birth and ethnicity. And then any additional information that a researcher would need from those women, they would get later on when they enrolled them into the study. So how do we send our emails to the Army of Women? We send the emails to the entire database when a study becomes available, and that's another really important point. We're not sending a study from Florida only to women in Florida. We're sending that study to everyone throughout the U.S. and internationally. And if that person may not live in Florida, they may know somebody who does and share that study with their family member or friend. And so we really want to get to these people virally. If a woman is interested in signing up for the study, she RSVPs on the website and goes through an online screening that we'll talk about a little bit more later. And then we at the foundation manage the subject list and then pass the information on to the researchers so that the researchers then go through the consent and enrollment process with the women. And a couple important points: as I said before, we're not matching these women to the studies. We're not sending it to specific geographic areas or women with specific medical conditions. It's going out to everyone. And we're also not a clinical trial matching program or a tissue bank. So for you researchers, how does it work? So there's also a way for researchers to register and create an account, and creating this account allows you to then submit applications for review, which I'll talk about a little bit later. So you register on our website, and then you're able to access our membership base of more than 371,000 women. And then in terms of your studies and how we can help researchers, we help you guys in multiple ways. So if you don't have funding, you can come to us for a letter of support for your grant application. So if you'd like to submit an application for grant funding and want to say, we're going to recruit through the Army of Women, we can take a look at your study. If we think the study is appropriate for the Army of Women, we'll provide a letter of support to include in your grant submission package along with our cost information. If you have a study that's already funded, but it wasn't funded by a peer-reviewed source, then you're going to submit an application to us. Then we at the foundation review it for scientific merit and appropriateness, and then we also send it on, if we think it's a good fit, we send it on to our external scientific advisory committee, comprised of researchers, clinicians, and advocates. And for these non-peer-reviewed funded studies, we send it to 2 scientists and 1 advocate for review. And if those studies are approved, then the study PI will go ahead and get additional IRB approval to do online recruitment via the Army of Women. For those of you with peer-reviewed funded studies, we don't want to do the peer review process over again, and so we review the study at the foundation to determine if it's a good fit for the Army of Women. If it is, we send it on to our scientific advisory committee, and at this time it would only be 1 scientist or clinician and 1 advocate reviewing the study. And again, you'd have to go through and get the additional IRB approval for online recruitment. So those are a couple of ways. If you don't have funding, we can help you, and if you do have funding, we can help you as well. So a little bit more information about the External Scientific Advisory Committee. We currently have 52 members on the committee, and those include researchers, clinicians, and advocates from throughout the U.S. As I said, all studies have to have IRB approval before going out to the Army of Women, but they also have to have additional IRB approval for online recruiting before we send a study email out to the Army of Women members. Over 90% of our studies are peer-reviewed funded studies, and we work on a cost recovery model of $1,500, one-time cost to do all the work we do for you. If a study is approved, the average time to launch a study after an application is submitted is approximately 90 days. This time to launch depends on many factors. That does include the review time by the External Scientific Advisory Committee. We also have a legal agreement, our memorandum of understanding that we need to execute, and so the timing for launch depends on how quickly that can be executed, how quickly the IRB can approve the e-blast, and any other sort of factors going in. That timeline can definitely be pushed faster if necessary, so please don't hesitate to come to us if you need a study to launch sooner than 90 days. In terms of the applications that we get, about 67% of the applications have been approved. And in terms of the reasons that the studies have been denied access to recruit via the Army of Women, mainly it's applications that have come in that haven't necessarily focused on breast cancer, or it's a cohort study, which at this time, to avoid confusing our members, we currently do not help recruit for longitudinal cohort studies. Also, if it's a clinical drug trial, we currently do not help recruit for these types of trials. A lot of those studies are looking for women who are just starting treatment for their breast cancer, and unfortunately, we're just not the best for that type of study. The women aren't necessarily reading our emails while they're going in to begin treatment. And also, if a study is not appropriate for the Army of Women membership, maybe due to the eligibility criteria. For example, if a researcher is looking for women, like I said, who were recently diagnosed, we really aren't good at finding those women prior to starting their breast cancer treatment. So who are the Army of Women members? We currently have more than 370,000 women recruited and a few good men thrown in there. As I mentioned before, a whopping 70% have never had a personal history of breast cancer. So you have a lot of healthy women out there who are willing to be studied to help out just for the common good. 30% are survivors or going through active treatment. And very interestingly, 67% have no first-degree family history, and 27% have one first-degree relative who had breast cancer, and then only 5% have more than one first-degree relative who had breast cancer. So it's not necessarily, women in the Army of Women who are directly affected by breast cancer. It's obviously a universal goal to help end breast cancer. In terms of our breakdown of ethnicity, you can see that we are the majority, 86.4% are Caucasian women, but we do have quite high numbers of Hispanic or Latino women and African American women, over 12,000 in each of those ethnic categories. And we are definitely working hard to increase the diversity of the Army of Women as we move forward. You can see the age breakdown, 21% are 18 to 39 years old. And then the majority are over 40 years old, with 47% at 40 to 59 and 32% over 60. So going into just a little bit of overview of the Army of Women history so far and our success, we've launched 71 studies since 2008 to the Army of Women members. 51 studies have closed to recruitment. And 6 of those studies, the PIs actually increased their accrual goal due to the success of the Army of Women. And I have an example of that in a few slides later, so you can see that. 4 of those studies were recruiting on an international level. 26 studies were recruiting on a national level, and 41 studies were recruiting on a regional level. But many of those studies had multiple sites that they were recruiting for. On average, we launched 2 new studies every month. And to date, more than 81,600 members have registered to enroll in a study. And that means they have submitted an RSVP form to let us know they're interested in learning more and interested in signing up. And then those names are passed on to the research team to contact for follow-up. So next I'm going to give some examples of some of the studies we've helped recruit for. This is a regional research study. It's an Avon Foundation funded study by a PI at Virginia Tech, and it's stiff work and breast cancer risk study. And she is studying breast tissue samples from healthy women. She's looking at day shift workers and night shift or rotating night shift workers, and she's looking at how the wake-sleep cycle disruptions increase breast cancer risk. So for this study, we recruited the day shift workers very quickly. Shift workers were a lot more difficult to enroll. So we had a conversation with the PI about her very, very tight eligibility criteria, and we helped her see the light, and she expanded her eligibility criteria. And after that, we had 80 more night shift workers sign up to be screened for that study. And then for this study, the PI was unable to collect her own core biopsy samples and didn't have a collaborator. So we actually set up a little 3-way partnership between us, the PI, and then the Komen Tissue Bank at Indiana University. We are recruiting the women for the PI, and then the women are going to the Komen Tissue Bank to do their core biopsy donations. So it's another example of how we're partnering with other organizations and doing whatever we can to help these researchers find the women they need and also get the samples they need. Another regional research study, an Avon Foundation study, the BEAM study at Northwestern and Johns Hopkins. This study was looking for 400 healthy women. The women needed to go in and give nipple aspirate fluid, core biopsy, and blood. And this was one of those amazing studies where the research team was actually had so many women sign up and so many women express interest that they actually increased their recruitment goal by 100 women, due in large part to our support and participation with our Army of Women members. In total, they had 846 women RSVP to the study, and a very large 8% of those women were ethnic minorities. And the feedback from the PI was that the Army of Women was significantly more effective compared to their other recruitment sources. Another example, and this is a recent study that we launched toward the end of last year, the Environmental Exposures and Breast Density Study at University of Wisconsin and Fred Hutchinson Research Center. And this research team is investigating whether cadmium is related to breast density. They needed women to submit urine samples by mail, and they were going to measure the cadmium and other heavy metal levels in the urine samples. And the women also had to provide a recent mammography report to the research team. Their accrual goal was 1,000 women, and with the help of the Army of Women members, they exceeded their accrual goal in a mere 26 hours. And we provided them with 2,580 women interested in enrolling in the study. Now, they were recruiting on a national level, and everything was being done through the mail or over the phone or online. So this is a really great example of a national study and how quickly we are able to find these healthy women to send in their urine samples for the study. For the last example, we have a Komen-funded study, the Jewels in Our Genes study at University of Buffalo, and the research team is investigating whether there are undiscovered inherited genetic mutations unique to African Americans that may predict early breast cancer risk. So we started recruitment for this study in October of 2010. The PI's goal was 400 volunteers or 150 families because family members were also being asked to participate. The recruitment slowed down after we launched, and so again, the PI took a look at everything and expanded her eligibility criteria. We sent a new call to action to Army of Women members on February 22nd of last year, and 62 more women signed up, and of note, 71% of those new signups came within 48 hours of that email going out. In the end, the study closed to enrollment on June 15th of last year, and 33% of the study sample came from the Army of Women. So the research team was using other recruitment sources, but we were able to give them 1/3 of their study sample. So just to give an overview of our capabilities and a little bit of what we do best, you can definitely come to the Army of Women and look for patient-reported health and clinical data. If you need women to provide blood, urine, or saliva samples, we've had researchers collected at their institution, collect it via kit mailed to the members, or as is with the case with the Komen Tissue Bank, we may be able to facilitate the collection through one of our partnering organizations. We've also had researchers collect ductal fluid. And then in terms of tissue samples, as with the core breast biopsies, we are able to help with collection of fresh normal breast tissues, but at this time we do not have a system in place to help facilitate collection of fresh tumor biopsy samples. We have helped researchers collect paraffin-embedded samples, so they go directly to the women or directly to the women's pathologist to collect those blocks or those slides. As you've seen, we do really well with national studies, but we also help with recruitment for regional studies in those major metropolitan areas. And we've also helped recruit specific minority groups such as lesbians, Latinas, or metastatic breast cancer patients. Just some of the feedback we've gotten from our researchers: 100% would recommend the Army of Women as a recruitment source and would use us again for recruitment. And 86% of the respondents said the Army of Women was a significantly more effective recruitment method than anything previously used. And so we asked them, you know, that's great, but why do you think that is, and what are the main strengths of the Army of Women? And one of the researchers came back and she said it's the low cost plus high yield equals efficient recruitment, that they obtained 52 names and 22 of those took part in the study, and that was done in a matter of weeks. And previously they had spent a year in clinic and obtained about the same number of women, but at a significantly greater cost in terms of dollars and staff time. And another researcher, I love this one, she said that the online recruitment reaches a large amount of people in a very short amount of time. More importantly, she says volunteers clearly trust the Army of Women and are eager to participate in research. So I can tell you now that these women are there, they're available, and they're just waiting for a study that's perfect for them to participate. One of the other projects we're working on at the foundation is the Health of Women study. So this study is actually the offspring of the Army of Women. The Health of Women study is a longitudinal cohort study that will collect information from participants around the country and around the globe using the internet and mobile technology. And the goal of this study is to examine causes, treatment, and prevention of breast cancer. And so the reason we're talking about it here today is because we're recruiting participants from the Army of Women for this study and also the general public. The house study is open to all women and men over the age of 18, and the cohort is for both healthy women with no history. Is for both healthy women with no history of breast cancer and breast cancer survivors. And the reason why this study is important to talk about today is because a unique aspect of the study that is being done by the Dr. Susan Love Research Foundation and City of Hope is a data sharing model. So the de-identified data will be available to the at-large research community through an online portal, and this is, you know, something we're doing in the future. And then researchers outside of the foundation will also have access to the cohort if they are conducting survey-based research and need respondents and or follow-up data. So if you've got a study and you're looking to do some follow-up questionnaires and it's just some online surveys that you need completed the Health of Women study may be something that you would want to collaborate with. So the more researchers who have access to the data, the faster we can understand why women continue to get breast cancer and ways to prevent it. And to date, no one has really set up a model like this to bring together the public, the researchers, and the technology. So if you're interested in learning more about the Health of Women study, please send us an email, and we're happy to give you more information about that. So just to summarize the Army of Women and the Health of Women, we're really democratizing research and shifting the paradigm. We need to address issues that are important to the public. We need to include the public in the conduct and design of the research, and we need to increase scientific literacy and support as well. And as I've shown you, the public is ready and willing to partner with the research community to find the answers to these urgent clinical problems. And then with the right support, the AOW model can be expanded into all other diseases. So that's a future plan, possibly. So that's kind of the summary of what the Army of Women is and how everything works. This next set of slides, I'm going to talk about how you as a researcher can access the Army of Women, an application, what the review process is like, and just give an overview of how that would work if you submit an application to us. So as I mentioned before, you register as an Army of Women researcher on our website and create your account, and here's the link. And this recording of the webinar will be available to view later, and I can also share slides if you're interested, so please just send a follow-up email. And then these next few slides, I'm just giving you a view of what the website looks like. You've got the For Researchers tab on the home page, and once you click there, it takes you to the Register Now page where you can create your account. When we have the registration form, again, we keep it very simple. Just ask for some very basic information from you to get started. So if you are interested in including a letter of support from the Army of Women in your new application for funding, this just gives an overview of the type of information we're looking for. So I'll show you some screenshots in a few seconds, but you'll enter the requested information in there, and this just shows you what we're interested in learning from you before we review a study. And then you can also upload your NIH BioSketch or CV and a scientific abstract. And I just put a note on here that our system only accepts the Word 97, the 2003.doc documents or PDF documents. But unfortunately, we'll kick back if you try to upload one of those newer .docx files. So here's just a quick screen through of what it looks like to submit an application. Once you've created an account, you're going to go to the home page, click on that For Researcher Sign-In tab, and it takes you to the Researcher Login page. There you're going to enter your username and password, and there's some areas right down here that if you've forgotten your username or password, we'll help you out with that. So when you're going in, on the left, you'll see that you're going to submit your research proposal. You'll enter your project title, and then let us know whether or not you have funding. So if you're submitting an application for a letter of support, you of course click on No, I don't have funding. Go on to the next step. You enter in the requested information. Enter in the requested information. And then at the end, upload your BioSketch and abstract, and then request that letter of support from the Army of Women. So that application is reviewed by the AOW team at the foundation. We are trying to determine if the study is an appropriate fit for the Army of Women. If it's approved, you will receive a letter of support with us along with that cost sheet for budgeting purposes. And then go ahead and submit that application, and if you get funding, which we hope you do, then you can come back to us and let us know and complete the full application for review by our External Scientific Advisory Committee. So, and that moves us on for your funded IRB-approved study. Again, you're going to enter in the requested contact information, your number of women needed, the inclusion-exclusion criteria, etc. For this application for a funded study where you're looking to recruit right now, you're going to upload your BioSketch or CV, an abstract, the budget award letter, a complete grant application or protocol, and the IRB approval document. And again, it's just letting you know which file types are accepted in the system. So for this next few screenshots, it's just showing you that if you currently have funding for your research, then you're going to submit a research proposal, enter in the requested information. You're going to upload your BioSketch and abstract. You can either save the application for later, or you can continue to the next step. If you're continuing on, you're going to enter the rest of the information, submit your IRB approval document, and your budget award letter and your grant application. And then you're going to give us your information for the contracts and grants officer, and then review and submit your application. Or again, if you've forgotten some paperwork somewhere else, you can exit and save that application for later. So in terms of the review process, the study is first reviewed by the AOW team at the foundation. If it's approved, we submit it to our external scientific advisory committee for review. And again, the peer-reviewed and non-peer-reviewed funding studies, it's either one scientist and one advocate, or two scientists and one advocate. If the study is approved by the scientific advisory committee, we move forward with the process. And so in terms of, I think the big question that all the researchers are interested in is, how does recruitment work through the Army of Women? So the next step in the process is to draft the email blast, or the e-blast, that will be sent to the Army of Women database. We draft that and submit it to you for review. Once we agree on the final version, it goes to your IRB for approval. And in that e-blast, we include sections on what the study is about, what's involved if somebody participates in the study, who is conducting the study, where the study is being conducted, and then who can participate. And this section really outlines your main inclusion and exclusion criteria. We execute the memorandum of understanding, and we invoice you for the $1,500 flat. So once the IRB approval for the e-blast is received, the MOU is fully executed and payment is received or in process. Then we send that e-blast out to the entire Army of Women database. And as I mentioned before, the women will self-select if they want to participate. They go through that online screening, and then the approved names and contact information is sent to the research team. And from there, the research teams proceed with any additional screening and go through the consent and enrollment process. So you're going to get a phone number, you're going to get an email address, and you'll have ways to contact the women depending on your next steps. So to end, I'm going to give you my contact information. You can feel free to email me at any time. You can also give me a call at the foundation. And then we have our website on there. You can look at that for additional information. We do have a FAQ page to take a look at, but again, I'm happy to answer any questions that anyone has. So with that, I don't see any questions right now. So I am going to escape out. And then I'm going to give the screen to Jen so she can talk about her fabulous study that we're helping recruit for.
Thanks, Leah. I really appreciate being part of this webinar. And welcome everyone to the Army of Women. We are pleased to partner with them and feel that our study would not be possible without this partnership. So I'm part of the Young Women's Breast Cancer Program at Washington University School of Medicine in St. Louis, and we have a comprehensive program focused on women who are diagnosed 40 years of age and younger. So we offer a number of educational and support programs for women who live in the area, and through we've developed a number of young survivor magazines that we've recently distributed nationally to young women. And as part of this work, working with Dr. Paul Goodfellow, who is a cancer geneticist, we developed a specific research project focused on women who are diagnosed at a young age, and that's what I want to talk to you today about and really reinforce a lot of the points that Leah has brought up. Our initial questions were to identify, work to identify the genetic factors that contribute to risk for breast cancer, and in particular among women who are diagnosed at a young age. And then a second initial question was really trying to understand how common is familial breast cancer in this young group of women who have been diagnosed, and trying to understand their family history of cancer. So for our particular study, we were inviting women who were diagnosed 40 years of age and younger. Their current age for our purposes did not matter, nor did it matter if they have had clinical genetic testing and what the results might be. And so you can imagine, as Leah brought up, the ability to recruit minority women. We certainly considered women who were diagnosed at a young age in this minority group, given that only about 6% of women who have breast cancer are 40 years of age and younger at the time of diagnosis. For the women who participate in our study, we ask them to sign a consent form. We send them a kit if they don't live locally so that they can, at their next laboratory, have a sample of blood drawn and shipped to us. That's paid for. We have a paid FedEx bag that's included in the kit. And then we contact them about their family history and ask them to release a copy of their cancer-related records. We also asked their parents and sisters to participate as controls, so we were taking advantage of the fact that we did have a group of young women and their parents may be living and can be used as controls in our genetics studies. Like many of you, we were using very traditional methods of recruitment through our genetic surgery and oncology clinics here at the institution. There is a conference for young women that's held every February, and that's sponsored by Living Beyond Breast Cancer and the Young Survival Coalition. And so we attend that meeting each year to invite women to participate. We also have a number of invested collaborators around the country who want to help advance research focused on young women, and then using traditional approaches again like clinicaltrials.gov and breastcancertrials.org. And interestingly, like many of the women in the Army of Women, young survivors have an incredible network and will encourage other young women who've been diagnosed with breast cancer to participate. So this recruitment really began in April 2005, and we began to partner with Army of Women in May 6, 2010 was when Leah sent me my first list of eligible women who were interested in participating, and I joke that that began at 10 a.m., 10:08 a.m. to be exact, and you'll see in a few slides why I make that specific mark. So we're very grateful to Army of Women, and we joke that we've been hit by friendly fire because we would not be able to move forward with this study without their partnership. To date, we have over 1,900 women who have all been diagnosed with breast cancer, less than 40. Sorry, I have a typo. I'll add that to the slides. And for those women who have already participated, they've sent in their blood as well as medical records. We've been able to obtain family histories, complete 3-generation family histories for these women, and have over 1,700 parents and sisters who have enrolled as controls. From that, we have completed 450 trios, which would include the young woman who was diagnosed with breast cancer as well as both of her parents, and that again allows us to do very specific genetic studies for these families. Our average age of diagnosis is close to 35 years of age, and average age of consent is just over 40 years of age. What has helped by partnering with the Army of Women is not only the sheer number of women who participate, but also the diversity, and I hope I can show that to you in the next few slides. So of the women who have had genetic testing, we asked them specifically about genetic testing, any genetic testing that they have. Many have had analysis of the BRCA1 and BRCA2 genes, and over 16% of the women who are participating in our study have a known mutation in one of these two genes. We have, in fact, 5 women who have a mutation in both genes. And then we have 5 other women who have a mutation in other genes such as MLH1, CDKN2A, and so forth. Of the women who do not have a known BRCA1 or 2 gene mutation, 25% of these women have a family history that's suggestive of inherited disease. So we obtain a 3-generation pedigree, and we score each family history based upon the number of first and second degree relatives with breast cancer. In evaluating those women who have had genetic testing, nearly half have absolutely no family history of breast cancer. And so one of our questions is, what fraction of these women might have a de novo gene mutation that caused their breast cancer to develop? Of the women who have participated so far, 150 women have had a second or third primary breast cancer. And again, nearly half, or just over 40%, have no mutation in BRCA1 or 2 and have no family history of breast cancer. So these women will tell us a lot in trying to identify the genetic factors that contribute to disease. So just some data specifically on some of the numbers that Army of Women has contributed to our study. We're very excited that we have just enrolled the 1,000th member from Army of Women. And you can see from May 6th, we've had over 2,500 women respond to Leah's e-blast. Leah will provide an email to me with their contact information, and then I will contact each woman directly. From that, we've had over 1,400 women respond to me, indicating a desire to participate. And of those 1,400, we've had 1,000 women complete their enrollment. This percentage, 70% who have completed their enrollment, is much higher than we've been able to achieve working with other organizations, such as through the Conference for Young Women. So women who sign up for the Army of Women are very interested in research and following through with that activity. We're now to a point where Army of Women has been able to recruit a higher number than we have through our traditional methods. And we hope to invite 5,000 young survivors to participate. You can see our numbers, how they dramatically increased in 2010 following the announcement from Army of Women, and they have continued to be higher in recent years than they were prior to our partnership with Army of Women. These numbers have dropped down a little bit in 2012, but that's due to some staff turnover, and we're still hiring a research assistant to help me with the recruitment. But as you can see, it was a dramatic increase, and I think reinforces a lot of what Leah has mentioned with the other studies of how quickly we can identify women to participate. And that will be important as you plan your studies to be ready for recruitment so that you can respond as quickly as possible when the blast is sent out to enroll women into the study. We have women from every single state in the United States, and then we also have some women from Canada who are participating. So it's really an incredible experience to have women all over the country trying to make a difference and gain a greater understanding of why young women develop breast cancer. You can see prior to and participation and partnership with Army of Women, most of the women who were enrolled in our study are Caucasian, and that remains true today, but as noted in some of the data that Leah provided, there's good representation of minority women, and we've seen the greatest increase in Hispanic and Latino women participate in our study after our partnership with Army of Women. What we've also been able to achieve is reaching women who are long-term survivors. So we have a much higher percentage now of women who are at least 10 years out from their diagnosis. And that allows us to begin to develop a research cohort, if you will, and begin to examine some new questions that we weren't able to address before. One of the offshoots of our study has just developed, and it was exciting to see that the Health of Women study has really developed because of the Army of Women. And because of our partnership with Army of Women and the large number of women we've been able to enroll so far, we've recently developed a new study working with Kim Cappings here at Washington University, who is an expert in public health genetics and health literacy. And so we've just initiated a communication studies looking at the preferences of young survivors regarding whole genome sequencing data. So that has recently started, and we will be expanding that to our entire group of women who have participated in our genetic study through January, in January 2014. And honestly, Kim's study would not have been possible if it weren't through the partnership of Army of Women, because we would not have been able to recruit as many women to the study as we would have liked. I failed to mention that it was because of the partnership beginning in 2010 that we were able to obtain an R01 grant from NCI in 2011. And it was only because of that recruitment and having those large number of women in place that we were able to obtain that grant funding. So if you have some type of gift funds or startup funds to begin your research, if you can work with Army of Women to build your research population, that's going to certainly help as you apply for national grants. And I'd just like to end with this nice quote from Washington Irving. This is how I think about the Army of Women and what they can bring and change really breast cancer research in our country. And I'm happy to take any questions.
Thank you so much, Jen. I wanted to also mention to everyone that Jen is also the director of the Young Women's Breast Cancer Program at WashU, and you can see they're doing some amazing things at that program. So thank you for sharing that wonderful information, and we do have some questions to go through. So we do have a question to talk more about how the IRB works. And the question is it mainly the IRB as a researching institution or through your organization? So to answer that, it's all the IRB approval is going through your research institution. So if you have a study and you come to us and you're funded and you don't have online recruitment in your research protocol, your IRB protocol, you'll have to amend your IRB protocol to include online recruitment, and then we will provide that Army of Women e-blast, a draft of the email that you can submit to your IRB as well, so that they can approve that to go through. And once that IRB approval comes through at your institution, we'll send out the e-blast to the Army of Women members. So we don't work directly with an IRB through the foundation for the Army of Women program. But I would like to add that we are happy to help with the IRB process. We've definitely worked with researchers who don't have a lot of experience with the IRB, and we've helped them draft materials if needed, and we provide all the information about the Army of Women, and we're also happy to answer questions that the IRB may have when they go through the review process. Some of the institutions we work with, we've worked with them multiple times, and so when the IRB sees Army of Women, they're familiar with it. But for a new institution that we haven't worked with, we are definitely happy to provide additional information through that review process. So I hope that answers the question, and if you have additional questions, please type them in or feel free to contact me directly about that. The next question is to talk more about the logistics and costs involved in obtaining the blood samples via the mail. So Jen, I think that question is for you.
So what we will do is send everyone a kit, and a kit is a large envelope with paperwork and blood tubes in them. We have a specific blood tube vessel, if you will, that we send to people. We have labeled tubes that we send them, and we write a prescription so that they can take that to their physician as part of a follow-up appointment, or if they are an unaffected family member, can take it to a laboratory or their primary care doctor. So to mail the kit, it's quite honestly, it's about $6 or $7 to mail that. The contents of the kit cost about $5, and then we will pay any phlebotomy charge. That runs anywhere between, it's amazing the variability in what institutions are charging for phlebotomy. We've had charges as low as $4 up to $80. But generally it's around $20 that an institution will charge for phlebotomy. Many young survivors who are having their follow-up blood work were not charged for that phlebotomy because they're already having blood taken. To return the samples via FedEx, those charges are usually less than $20 per person. So that's, I hope that answers your question.
Great.
It's really...
And do the women ever run into any problems with getting the blood collected when they go into their doctor's office or go to a lab?
By and large, no. That most women have absolutely no problem. Their providers are very supportive and trying to be helpful and help facilitate their participation. On occasion, we have had women contact us saying that they have run into trouble, or if they're an unaffected parent or sister and they go to a laboratory, some of the laboratories have not drawn their blood. And in those cases, what we've done is we can obtain a sample of DNA by asking them to provide a spit sample, and that would require a separate, obviously a special vial with preservative that we can send to them, and then they can send back to us via regular mail. Yeah.
Great. All right, well, one of the other questions that just popped up was a question about the cost and logistics involving one of the Army of Women partnering facilities for tissue collection. So for that, I can just give the example. The one we've been working with is the Coleman Tissue Bank in Indiana. They do have a website, and their website explains they have a separate application process and request for samples. So if you are looking for healthy, normal tissue samples and you don't necessarily need a specific group of people, you may be interested in looking at the Coleman Tissue Bank website just to see if some samples may be available. But if you're looking for more specific information about the women and you want them to give not only their sample but maybe complete a detailed questionnaire, or you're looking for, you know, metastatic breast cancer patients or shift workers like we're recruiting for, then the recruitment goes through us, and that's a $1,500 fee. And then paying for the samples through the Coleman Tissue Bank would be paid directly to them. And I believe right now they're charging $200 per core sample, but again, that would be on their website. So in terms of partnering organizations, we're really a facilitator, but then the payment would go directly to them. We have had some researchers who have worked with Quest Diagnostics laboratories to do blood collection or urine collection. And in those instances, Quest does not work with third parties, so they would not set up a contract with us at the foundation. So they work directly with the researchers. So we've had researchers go contact Quest Diagnostics, set up a contract, and then they pay them directly to have Quest collect the blood samples or the urine samples from study participants. And that has actually worked out well for some of the researchers because Quest Diagnostics has locations nationwide. So it really has enabled you to expand the scope of your study. If you'd prefer to do that, then have women come into your facility to have the urine or blood or tissue collected. So I hope that answers that question. And then the next question we have here is, how have studies obtained informed consent? And is questionnaire data typically collected via mail, telephone, or using an online questionnaire? Is one method more successful than the other in the Army of Women? So first of all, for studies obtaining informed consent, it really depends on how the study is being conducted. Some researchers obtain informed consent at their institution if they're doing a procedure where the women have to actually go in and see the PI. Other institutions will do their informed consent by mail. And I think, Jen, do you guys do your informed consent by mail?
Yes, we will send them a consent form to sign as part of their kit.
Excellent. Okay. And then we also have had research teams, depending on the type of study they're doing, they will obtain informed consent over the phone, or they'll do it online. So we have had, you know, these online studies, and they'll just go through the consent process directly within that online questionnaire. And so in terms of how is the questionnaire data typically collected, you know, it's mail, telephone, and online questionnaires. And I would say that in terms of one method being more successful than the other, it really depends on the system set up at your institution. I think some institutions have really great systems set up, and they're able to collect that online data really easily and have that, you know, system set up. If that isn't available, you know, definitely mail and telephone do work. But I think in terms of making phone calls or sending out emails that, you know, don't necessarily, sending out mail that they might not necessarily return right away, the quickest return is going to be by that online survey questionnaire. So again, I hope that answers that question about the online surveys. Are there any additional questions that anybody has about either the Army of Women, our processes, or would like to ask Jen about her experience using the Army of Women? I think she's a really great asset for us to have because she's able to talk about her years of experience recruiting through the Army of Women and some of the things that work and some of the things that don't work. All righty. I don't see any more questions coming through, and so I think we'll just end that here. Again, thank you, Jen, so much for joining us today.
Thank you for asking me. Yeah.
Of course,
I really appreciate it. Yeah.
Definitely. And then for everybody on the line, like I said, send me an email, lwilcox@dslrf.org, or give us a call here, and we're happy to talk to you about your study. So thank you for joining us today, and we will be putting this online so that you can share it with all of your colleagues. Thank you.